Hi, it's Neil Gerrard here from Clifton Dental Studio, and we have some great news. We are now open again following the COVID-19 lockdown and pandemic, and thought it'd be useful for you guys to know what we're doing for your safety and comfort for your next appointment. So me and the team have been working really hard over the last few weeks to implement some enhancements and upgrades to the process of your treatment and also what you'll experience when you see us. So what are we doing to protect you, and what should you expect to see during your next visit? Well, your safety is the number one priority to me and all the team. So we want to keep you safe, but also provide you the care to the same level that we've always done. Infectious viruses is something that we've always dealt with in dentistry, going back 30, 40 years when to HIV or AIDS, hepatitis B, hepatitis C, and even mad cow disease. Over all this time, dentistry has proved to be very safe and will continue to be so, albeit for this particular virus in terms of COVID-19. We have made some small changes, small enhancements, again, to make sure we're protecting you and protecting us as much as we possibly can. We have some new systems in place, which if you're a regular member of the studio, you may find a little bit different. And we've also done lots of we've completed lots of team training over the last few weeks to make sure me and all the team know how to keep you and us safe. We've invested in air sterilisation technology. So in terms of all the suites, we have air sterilisation units in them so that we can remove all the bacteria and all the viruses from the air that we're breathing, including COVID-19. All with the view of keeping you happy and safe. So what will this mean to you at your next visit in terms of what will you see when you actually come to see us? So before you see us, before you attend your appointment, we have introduced more virtual conferencing in terms of video chat, Zoom, FaceTime, things like that. And that will enable you to discuss any concerns that you have about your smile or your dental health, whether that be something that's not urgent at the point in time or something that's very urgent that we need to see as soon as we possibly can. In terms of your actual appointment, 24 hours or so before then, Julie and the team will attempt to contact you to make sure that you're feeling well. If you have a temperature, which may suggest that you have COVID-19 infection, please don't be offended if we ask you to delay your appointment by 14 days. During that time, we'll also request payment in order to reduce the number of interactions that you will have when you come in to see us. We're doing many virtual processes and also taking prepayments on all treatment. So again, please don't be offended if you ask for this before you come in. If you paid previously after treatment and you're a regular member of the studio, we will still request this again on the grounds of safety for you and safety for us. When attending the studio for your appointment, if you're coming by public transport, it's likely that you will have to wear a face covering anyway, but we will ask you to wear a face covering, whether it's a surgical mask or something you have made yourself. Otherwise, in terms of protecting yourself and reducing the risk of spreading of COVID-19. If you're coming by a car, by somebody, when you're arriving with a friend or family member, then we still ask that they stay in the car and you please come in to see us. If you're early for your appointment, please stay in the car and please don't arrive until 5 minutes before your appointment. If we're able to see you sooner, we will give you a call and ask you to come in. If you have lots of belongings with you, please leave those in the car as well. On entering the studio, we're going to ask you to sanitize your hands to minimize, again, the spread of infection. And also we'll ask you to wear a face mask. And if you haven't got one, we'll provide one for you. We will check your temperature. Anybody with a temperature of 38 degrees may be infected with COVID-19, and therefore, again, please don't be offended if we delay your visit and ask you to come back in 14 days' time. This is something we also do for your safety for every team member every day. We check everybody's temperature when we come to the studio in order before we actually see you. Team members will be cleaning more regularly in areas where patients and staff, the common areas mixed. For example, door handles, banister rails, etc. have been shown to harvest the virus for a number of days. It's something we clean on a regular basis anyway, but we've enhanced this to make sure, again, that we're meeting all guidance that we should meet and keeping you as safe as we possibly can. You'll be invited into one of the suites where we may already be dressed like this, wearing our personal protective equipment. So this is not just for low-risk patients. We're also wearing this for those that are deemed vulnerable or are shielding. So the precautions that we've put in place across the board are for everybody. Please remember though, it's still us underneath. We're still the same friendly team, and you will still be able to interact with us, but maybe not quite as much as before. As always with your care, we want you to experience great care, judgment-free and pain-free treatment, so that when you leave us, you're completely happy with what we've done for you, but also the way you've been treated as well. On leaving the studio, you'll be escorted to the front door. We'll ask you to wear your mask again, and also disinfect or sanitize your hands before you leave for your protection and protection of the public. If we haven't been able to arrange an appointment at this point in time and you need another appointment, Julie and the team will call you again within the next 2 to 3 days to schedule that in the diary. And then finally, if you have any further questions, you're more than welcome to give me and Julie and the team a phone call, drop us an email, and we're happy to answer any questions you have. If you are classified as vulnerable or you are shielding, please be confident that we've introduced all of these measures for everybody, so you are safe to come and see us, but we may ask that you come to see us for specific appointment times, for example, first thing in the morning or after lunch, so that we know that you're mixing with as few people as possible. So I hope this helps put your mind at rest, that we're doing all the things we should be to keep you as well as us safe, and we look forward to seeing you soon. So keep safe, keep well, and keep smiling.